What if I told you that your body's biggest annoyance is actually its greatest superpower? Seriously, think about the last time you got a simple scrape or a paper cut. You get that redness, the painful swelling, that heat radiating from the skin. It's incredibly frustrating, right? Like most of us just want it to go away instantly. But what you're experiencing in that exact moment isn't just a nuisance. It is a highly coordinated, literal biological rescue mission unfolding right beneath your skin. And it's an incredibly precise operation that happens every single time you're injured. Welcome to today's Explainer. Today, we're using Chapter 5 of Dr. Harsh Mohan's renowned Textbook of Pathology, 7th edition, as our definitive map into the microscopic world. And look, this isn't just some dry medical text. It's a front row seat to the most sophisticated battleground and construction site on Earth, your own biology. We're going to unpack exactly how your body defends itself, how it tears down the damage, and ultimately how it rebuilds the whole shebang. Okay, let's dive right into this. We're going to cover 5 main things today. First up, the acute inflammatory response. Second, we'll meet the inflammatory cells. Third, chronic and granulomatous inflammation. Fourth, tissue regeneration and repair. And finally, we'll wrap up with stem cells and healing.
All right, starting with part 1, the acute inflammatory response.
I want you to imagine a sudden, blaring emergency alarm going off inside your body the very second tissue is injured. The pacing here is incredibly fast. I mean, it's urgent. It's an immediate physiological reaction to damage, specifically designed to contain the threat the moment it occurs. The textbook lays out this very precise 4-step progression for this acute phase. First, you have the inciting factors, so the actual triggers or agents causing the injury. Second is morphology. This describes the immediate physical and structural changes actually happening in your tissues. Third are the biological effects that kick in to fight the damage locally. And finally, the fate of the tissue. Basically, will the inflammation resolve? Will it escalate? This 4-step process is literally the fundamental blueprint of biological survival when you're faced with sudden trauma. Now, to manage this sudden emergency, the body relies on 2 massive opposing forces. First are the mediators of inflammation. Think of these as chemical sirens. They are the signals echoing through your tissues, screaming for microscopic help. But, and this is crucial, just as important is the regulation of inflammation. This is absolutely vital, because without strict regulation, the body's inflammatory response would just keep escalating, ultimately attacking and harming the very tissues it's trying to protect. So the biological brakes are just as important as the gas pedal here. Moving on to part 2. Meet the inflammatory cells. So the sirens have sounded, the alarm is ringing, and now we transition from that initial alert to the arrival of the actual biological first responders rushing to the scene of the injury. To kind of make sense of this dense terminology, let's anchor these concepts to their narrative roles. So the acute inflammatory response. That's your emergency dispatch. It's the system recognizing a problem. The mediators of inflammation act as the chemical sirens alerting the rest of the body. And the inflammatory cells? Well, those are the first responders. They're the microscopic boots on the ground. They arrive at the site to do the vital, frankly exhausting work of neutralizing the threat and clearing out all the cellular debris. And they function perfectly together, just like an elite emergency response team. Which brings us to part 3, chronic and granulomatous inflammation. But what happens when that initial rapid response simply isn't enough to clear the danger? Well, the timeline stretches out. The pacing slows way down. We shift from a fast, acute, blazing emergency to a stubborn, lingering war. Now, what's really interesting about this contrast is how the source draws a line between 2 stages of defense. On one side, acute inflammation, which starts around page 116 if you're following along, is that initial, immediate biological response. Fast, aggressive. But on the other side, around page 134, we hit chronic inflammation. This is a prolonged, lingering physiological battle. The rules of engagement have completely changed here, because the initial threat was just too stubborn, too hidden, or too resilient to be neutralized by the first responders. And within this complex chronic phase, the textbook highlights a very specific condition called granulomatous inflammation. Let's give this heavy medical term a little breathing room so we can really grasp it. Granulomatous inflammation is a highly specific, complex pattern of chronic inflammation analyzed in pathology. It is not just generic, lingering swelling. Instead, it's a specialized, highly organized defensive strategy, where the body, basically unable to destroy an invader, literally attempts to build a microscopic wall around it to contain it. How crazy is that? And it is incredibly fascinating because it's definitely not a one-size-fits-all approach. The source specifically categorizes multiple distinct examples of granulomatous inflammation, which just proves how meticulously your body adapts to different types of microscopic threats. It doesn't just use one type of wall, it actually tailors its lingering defenses to perfectly isolate specific enemies based on exactly what they are.
All right, part 4, tissue regeneration and repair.
Eventually, though, every battle has to come to an end. We're officially leaving the biological battlefield behind and entering the biological construction site. The tone shifts from defensive destruction to, well, incredible, optimistic rebuilding. So the crucial point here from page 155 of the textbook is that it clearly delineates how the entirety of healing relies on two distinct, separate pathways: regeneration and repair. They sound similar, sure, but in pathology they're actually very different. Regeneration is the ultimate goal. It is the perfect replacement of damaged tissue, leaving it exactly as it was before the injury. Repair, on the other hand, is basically the body's way of patching things up quickly, which often results in leaving a scar.
Let's move to the timeline and see how this builds. At the exact moment of injury, you get that fast, acute inflammatory response. If it's unresolved after a few days, you enter that lingering chronic inflammation. But look at the weeks following the injury. This is where the actual healing of skin wounds takes place. This perfectly illustrates how that terrifying, painful, acute response we talked about at the beginning is actually the mandatory first step toward healing a wound. You literally cannot have the biological construction site without the inflammatory cells clearing the area first.
However, as we look a little deeper, we learn that not all tissues are created equal. The textbook draws this fascinating distinction between the everyday healing of skin wounds and healing in specialized tissues. It turns out your body has entirely unique, highly complex repair protocols dedicated strictly to these specialized areas. It intuitively recognizes that a specialized internal organ needs a very, very different reconstruction plan than, say, a simple scrape on the surface of your knee. And finally, part 5, stem cells and healing. This leads us to what is easily the most forward-looking concept in the whole chapter. We're looking far beyond just patching things up with scars now, and this brilliantly illustrates the cutting-edge focus of pathology. Reading straight from Dr. Mohan's subheading, the stem cell concept of healing, regenerative medicine. The text transitions us from traditional repair mechanisms into the incredible, limitless potential of genuine regeneration. To summarize this whole concept, this stem cell is the ultimate biological blueprint. In the field of regenerative medicine, scientists and pathologists study these stem cells because they basically act as the body's master architects. Unlike other cells that have just one specific job, stem cells possess this seemingly infinite potential to divide, adapt, and reconstruct damaged areas from the ground up. They don't just patch over a wound, they have the power to entirely rebuild the specialized tissues we were just talking about. Which leaves us with this final, honestly incredible thought to ponder. We've seen how the body uses inflammation to fight and repair processes to patch. But if our own stem cells hold the master blueprint for infinite perfect repair, are we on the verge of outsmarting injury altogether? It's a question that really makes you marvel at the hidden microscopic architecture of your own biology, and for sure leaves us all eager to explore exactly where regenerative medicine is going to take us next.